Hi guys, Mr.Physio here. I've done 2 videos so far about shoulder impingement and the rotator cuff muscles. Today is the third one about supraspinatus, the victim of shoulder impingement. Supraspinatus sits on top of the shoulder blade. So this is my left shoulder. There is a groove on top of the shoulder blade, and then starting from here all the way to the tip of the upper arm bone. When it contracts, just lifting your arm up like this. Okay, so rotator cuff muscles, including supraspinatus, actually fine-tune the movement. So if the rotator cuff muscles don't work properly, the supraspinatus on top of the shoulder blade will get pinched all the time, every time you lift your arm up. That's why it's a victim of shoulder impingement. If you keep irritating the muscle, your muscle can get a little bit tensed up. So it gets quite tight if you keep irritating the muscle on top of the shoulder blade. Aww. So once it gets tight, it also has a secret function. So this tissue is your muscle, attached like this. If this muscle is getting tight in the middle, that's pulling your shoulder blade out to the side this way. Okay? So that does what's called downward rotation. So this is called upward rotation. The opposite movement is called downward rotation. But remember, in the first video of the shoulder impingement, I told you your shoulder blade has to go out to the side every time you lift your arm up. Without the shoulder blade movement, you get stuck at 90 degrees. You keep hitting that undersurface of the acromion, which is the tip of the shoulder. So to avoid that impingement, you have to be able to bring your shoulder blade out to the side like this way all the time. Every time you lift your arm up, the shoulder blade goes out to the side like this way to assist the arm movement. But now the supraspinatus tightens up in the middle. That's giving the force to bring the shoulder blade out to the side this way. Inwards, we want that movement going out to the side, but it brings your shoulder blade inwards that way. To solve the problem, that muscle needs to learn how to lengthen up while generating power, which is called eccentric contraction. So that muscle is quite tight at the moment. So if it contracts, that's actually lifting your arm up. That's what it's meant to do. But at the same time, it's actually bringing your shoulder blade out to the side if it does the normal contraction. So we want to teach it how to lengthen up while activating. So that's activating and lifting your arm up. At the same time, that shoulder blade has to rotate out to the side, has to do the upward rotation. So this muscle has to elongate while activating. Hope that makes sense. Now, I've done a few videos about tendon rehabilitation, and this is also tendon problem. Tendons attaching your muscle to the bone, and tendons don't like compression and stretching. So if you actually stretch out your muscle like that, so some people actually doing this kind of stretching or just backwards this way, it's actually making that problem worse. Okay, so don't stretch on the tendon if you have a trouble. I'll give you a very simple technique to loosen up and evidence-based strengthening exercises for the supraspinatus. To massage that muscle, you need to find this bony area. The shoulder blade sits like that. This is the tip of the shoulder here, and try to palpate along the bony area. So once you find the bone, you just bring your fingertips a little bit on the top. So palpate the bone, bring your fingertips in there. So you have to press down like that, okay? So I find the bone first, bring my fingertips a little bit upwards, a couple of centimeters, just press down. Yeah, from here all the way in and out. Or you can press down and just go side to side that way. Okay, so about 5 seconds here or 5 seconds there, and all the way about 10 centimeters, about your shoulder width apart. Okay, so that much. Alright, so that's where I'm pressing down. And next is different technique. You activate the muscle while pressing down. While massaging the muscle, you just activate the muscle, okay? Press down onto the same spot and just lift your arm up about 45 degrees out to the side. In and out. So initially maybe slowly. And once you get better, you can go a little bit higher. When you do that, palms pointing the ceiling, palms up. Few spots, maybe 5 times here. 1, 2, 3, 4, 5, and maybe move on to the next. 1, 2. So a few different spots, maybe starting from here, 5 times, 5 times, 5 times. If you feel some areas tighter, you just do more massage on those tighter spots. And then we're gonna finish with eccentric contraction again. I believe a lot of our muscles need to be trained in that way. Once they can do that, they can do normal shortening, lengthening exercise, concentric and eccentric exercises at the same time. That's called isotonic. But for now, in rehabilitation, your muscles normally really tight, so it's kind of forgotten how to be lengthened under loading. Okay, so I normally use this kind of loaded eccentric contraction at the beginning of the rehabilitation, and then teach them how to, shorten and lengthen while generating power. So your muscle gets shortened when you lift your arm up, and when you bring your arm down, your muscle is being lengthened. Okay, so we're gonna use that muscle in that lengthening phase. Bring your arm out to the side, a little bit forward, about 30 degrees forward like this, and try to press down with the other hand while you're resisting with this right hand. Okay, so resisting, so your muscle is activated when you resist the left hand, and slowly go down. Okay, so in that way your muscle is activated and just lengthening as you bring your arm down. Push down with the left hand, and the power is about 30-40% of your full power, so don't push too hard and don't just bring your arm too quickly. Okay, and nice and slowly. So out to the side, 30 degrees forward, just press down. So you can do them about 5 times to start with, and then just slowly build up 10 times, 15 times, 2 sets of 10, 3 sets of 10, 15. Even if you work at office, you can just do some, repetitions when you have like free time. And if you have mastered the slow movement, you can go a little bit quicker, going down, going up, going down, going up, going down, but still resisting with your hand. If you can do the fast movement, you can do some weight training. Okay, so just going up and down, going up and down. 1 kilo weight or 2 kilo weight, you just slowly build up. According to EMG study, this is the exercise where the most activation of the supraspinatus occurs. So please apply and leave comments if you have any questions, and I will see you in my next video about infraspinatus. Thanks for watching.